Hello, I'm Jimmy Rawls. I'm an anesthesiologist here in Charleston for about 15 years, and just recently I've become an inventor. Mother of necessity, all that. The problem is, demonstrable by, have any of you guys ever had surgery, had a colonoscopy, any kind of procedure where you needed an IV? That little IV that you had in your arm, that technology is about 30 years old. If you've ever visited anybody in the hospital, you know what I'm talking about. There's these big loops of tubing that come out. There's the tape on your arm. There's the bruises from them having to start IVs over and over again. There's the annoying pump that alarms when the nurse has to come in and stop it and tell you to move your arm right and all that. Every day I deal with critical clinical situations where an IV is an absolute must. About 3 years ago, I got kind of irritated dealing with the technology that exists right now, and it has led me to be standing here in front of you today talking about J-Loop, which is my invention. It's a better IV. The best way to demonstrate current IV technology and my design would be to start IVs on all of you, but I don't think I have time for that in 5 minutes. So what I brought along is this simple drinking straw, something very familiar to all of y'all, that is pretty much the same way our current IV technology is. What we do is when we start an IV, we slide this off of a needle and into a vein, usually in a place in our arms where we bend or move, sometimes in our necks. And what happens when we bend or move, which we all do, is that catheter does this. Kinks. And when that happens, of course, the pump starts beeping, the nurse comes in. These things also piston back and forth inside the vein. They cause trauma in the vein. They cause clots. They cause infections. And it's quite amazing to me that nobody's done anything about this. And when I started looking, I was quite surprised. And I found out a lot about IVs in the past 3 years, you can imagine. There's 375,000 IVs started every day in America. Hospitals spend $630 million on just the catheters themselves, just the little pieces of plastic. About 50% of those fail within the first 48 hours, of those that stay in for that long. Some of them fail a lot sooner than that. If you've ever been in a hospital, you probably know that. Hospitals spend $1.4 billion every year dealing with failed IV problems. What I've done seemed pretty obvious to me, and I was surprised that nobody else has done a patent on it yet, so I did. Basically, what I've done is demonstrated by this kind of drinking straw, which you're all familiar with. It bends. Doesn't kink. Allows us to put the IV in the arm where it bends, in the hand, in the neck, and leave them there. I think there's going to be a whole lot less problems. The ones I've started on myself, and a few of the willing others have proved to be that way. So why would any of the hospitals buy this technology? Why would they change from what they're doing? There's 12,000 facilities in the United States that use these things. They're going to realize some savings in material costs because they're not going to be buying as many of the little catheters. But their main savings is going to be in reduced labor costs. That $1.4 billion is what they spend. That's spent on nurses restarting IVs, missed medications, extended hospital stays due to failed medication orders, infections, litigation, and worst cause that I've come close to witnessing myself is death as a result of a failed IV. It does happen. The place where we are, insurance companies and hospitals are guided a lot by insurance companies and Center for Medicare and Medicaid. They're going to look at better outcomes as a result of J-Loop. Manufacturers are going to want it because they're going to be able to have a higher profit margin, be able to charge a higher price for these individual catheters. Patients are going to want it because it's more comfortable, it's better, less holes in your body. Where am I as far as production J-Loop? I have a prototype that I developed with a company here in South Carolina called Zeus Manufacturing. I have a U.S. patent pending. I have an international patent search that has found no matches. I presented yesterday at the South Carolina Biotechnical Conference and have some interest from venture capitalists there. My plan that I need $500,000 for is to fully develop the existing 20-gauge prototype, expand the line of that while doing clinical testing, and eventually market to be bought by one of the big 5 manufacturers to distribute IVs worldwide. Why would anybody invest in me and J-Lube? Is that it? Okay. Questions?
So why would anybody invest in you and Jay?
It's a simple device. It's only going to take a 510K, I mean, you're all familiar with that, FDA prototyping, which means it's so similar to existing technology that you don't have to go through the full round of clinical and animal testing. They basically say, well, yeah, why didn't I think of that? And it goes through some minimal clinical testing, but it's much faster than your average FDA process. It's very simple to manufacture, and it can be mostly done right here in South Carolina, I believe. And Zeus has partnered with me. I got a great engineer that I'm working with there. The clinical testing can also be run locally. It'll be fairly fast, and I can be part of it, which is a great thing. And it should be a fairly rapid and significant return on your investment. I mean, you saw the numbers as far as the market, and it's such a simple thing. You know, most practitioners that I show it to are like, well, you know, why didn't I think of that? It's so simple. So I think it's going to be a fairly fast turnaround.
I've got 2 health-related questions. The first one is, are you solving a liability problem for any of these hospitals?
Well, you know, without absolutely testing it and saying, you know, yes.
Are you assuming that you'll solve a liability problem?
Exactly. Yeah, some of these IVs, when they fail, they cause infections, they cause problems, and nurses get stuck resticking patients. There's a lot of liability involved with all of that. There is some significant litigation surrounding IV failure.
And what about health rules in general? As soon as you get it cleared by FDA, then you can immediately go to each of these organizations and start selling this product into the distribution channel? Or is that the only hurdle?
That's the main hurdle. And finding somebody to manufacture it, you know, quality controls and all that. You know, medical devices, of course, are much more tightly controlled than your average widget. So in order to, and you know, that's where the $500,000 comes in, is getting a certified manufacturing process that is cleared by the FDA. We're talking about, you know, clean room technology and things that have to be done along those lines. The actual material is already approved, so that's not a big deal. It's just very expensive to go through the process, even a 510K process, to get to the point of saying, yes, this is a certified device that I can use in any human being I want.
As you know, when you file a patent, it has to be novel, useful, and non-obvious. And one of the problems that you run into sometimes when a lot of people say, why didn't I think of that, is you run into an obviousness objection. Have you had any feedback from the USPTO?
Yes, I have. I mean, my second objection from that office action, from my examiner. I have a good patent attorney who counseled me that was going to happen, so thankfully I haven't had a seizure yet. But yeah, there have been some obviousness rejections, but the art that has been brought forth from her has not really played out. We've been able to answer every one of them. The closest thing we found actually was a guy in 1971 who came up with a stainless steel catheter. He realized the same problem. It's a braided stainless steel flexible catheter, but it's a far cry from what we have material-wise.
So your IP lawyer remains optimistic?
Yes.
To add to that, I think first of all, it's brilliant. I can't believe it hasn't been done before. I completely agree with you. But to the point of the patent and the IP and the common use, do you think maybe that's why it hasn't been done before? Because first of all, there's a cost associated with it. It impacts major medical, and there's a huge medical lobbying group in the United States, and it's been thought of, but they didn't want to move forward with it because anybody could use it. Don't want to be negative, but I want to throw this out.
That's fine. I'm not sure I quite understand your question.
The question is, if it hasn't been done before, why hasn't it done before? And it's because of because it's the common, could be a common use. And maybe other medical companies have thought about it, but didn't want to impact their current revenue, their profitability.
You're saying if it ain't broke, don't fix it?
Yeah.
Well, that's what I'm here to prove otherwise. And I think it's just that nobody's really thought, you know, why can't we do this better? there's a lot of other things in the operating room that I've been sort of inspired by this to address.
But from a major, this would be a huge success, and I hope it happens for you.
Yeah, me too.
But to think about this, what would be the roadblocks in the way from you? Let's put the question is, what will stop you from doing this?
What would stop me from doing this? Hopefully nothing, but possibility that somewhere along the line we're going to bump into something unexpected as far as the design, as far as the catheter material not doing exactly what we expected to do when we get into big clinical testing. I mean, there are some things that could happen that I could envision. I don't think it. I certainly paid my attorney to do a lot of searching. There could be some other thing out there that's similar. I mean, I have the same approach. My approach all along has been this is just sort of a hobby thing that's grown because I try to convince people who convince me not to do this, and I haven't found anybody yet.
One of my favorite things in starting a new business is asking the question, is there something you could be doing right now today to be moving the sales ball forward? If we're patent pending and we're already in production, is there a way we could get a current distributor to start doing something? Is there some way we can go ahead and start getting in front of the FDA? What can we be doing? Because as an investor, if you say, all right, I need $500,000, it's a pretty big risk. It's a pretty big bite to make somebody jump off that ledge with that much risk. So what baby steps could you be taking in the interim?
I feel like I've done my homework as far as working with Zeus to produce the prototype that works. And what I need now is executive leadership and someone who has more time than me and is smarter than me to put the pieces together to get this through the credentialing, the FDA process, and to a manufacturer that can really produce a lot of the 20-gauge catheters to get clinical testing underway. And that's the next step, and that's a big hurdle. And that's where the cash flow has to come in, is to hire somebody good and let that person have resources to get in front of a manufacturer and